Good morning. Everybody has been looking at the internet in the last 24, 48 hours, and we have discovered, or the news agents have discovered, that you can apply for a $500 compensation or CERB when you get back from vacation. I think it's time we reviewed what that means. According to our local MP, it was put in place in September, the 27th of September to be exact, and it's a directive put in place by the Canadian Recovery Sickness Benefit. And what it means is the Canadian Recovery Sickness Benefit gives income support to employed and self-employed individuals who are unable to work because they are sick or need to self-isolate or have an underlying health condition. So then it goes on to the CERB is administered by the Canadian Revenue Agency, which we know. That being said, the question is, who can apply? And this is where the trouble comes in. If you're eligible for the Canada Recovery Sickness Benefit, you can receive $500, $450 after tax withheld, for each week period. To apply to the CERB, you must meet the eligibility required, be employed or self-employed on the day before your first application period. To be eligible for the CRSB, you must meet the following. You are at least unable to work for at least 50% of your scheduled work week because you self-isolated for one of the following reasons. You were sick with COVID-19. You were advised to self-isolate. And I think this is where the glitch is, because travelers are being advised to self-isolate. You have an underlying health condition that puts you at greater risk. So you can't apply for other things. That goes on, and you can't apply for other things while you are under this particular program, which is the CRSB. That said, it's the catch-up game that's driving me crazy. It's the catch-up. People were legally allowed to travel. I think we should stop beating the crap out of those people. They were legally allowed to do so. Illegally would be having dinner with your family. Illegally would be me having my grandchildren over since March. Illegally is having a gathering, or my 21-year-old son having some friends over. That's illegal. But I can't get into the gynecologist for the last 3 weeks because you can't get a regular appointment. They'll talk to you on the phone, but I don't know about you girls out there. That ain't going to help me today. So we need more in terms of that. So we're all willing to do what we're willing to do. Where I am having a problem, and many of you are going to agree with me, but many of you may not. The borders have been quasi-open under the bullshit disguise of closed borders. We've had immigration open. We've had 250 people a day. We have business people traveling in and out. Very little quarantine, because I know they're in my circle. There's no quarantine happening when people go and come from business trips. We can't go to Fairview. We can't go to Provigo properly and easily. And we can't be with our children. But we can travel. We can, gather outside, apparently, with very little consequence. I don't have a problem with any of it. To be honest with you, I'm okay. I would have traveled had I realized it was so easy and so legal. But when you take a step back and breathe for 5 minutes, you can see the posts from the nurses and the healthcare workers. So my instincts to travel were wrong, and thank God I didn't. But if you stop and think about it, it's the healthcare workers. And yes, I've heard that travelers represent 1.8% of the sickness. But that's when we weren't traveling. I'm not sure that's going to be the case when everybody comes back. I posted some visuals from the airport last night, from the Trudeau airport, and I feel that, it's as crowded as Costco on a Wednesday in 2010. It's crowded. Costco's crowded. Walmart's crowded. They're all crowded while we're sitting at home. I am having a problem with this now. I've been very, very, very willing to do what has been required. Wear the mask, don't wear the mask, put on this, wash your hands, do this, do that. I'm in. I'm doing it for people. I'm not in the age group, the risk age. I'm doing it for others. I'm doing it for my parents. I'm doing it for others. I'm just doing it for others because I personally am not fearful. I'm healthy, I'm fit, I take my vitamins, and I'm willing to risk the flu. But I'm not willing to risk the flu for my parents who potentially, you have somebody else's life in your hands, so you're doing it for others. My 21-year-old son is doing it for others. My grandson, who has a speech delay. Why does he have a speech delay? Because everyone around him wears a mask. He's 18 months old. He's perfectly coming around it, and it hasn't been easy on him, but he's delayed. There was chaos. He's delayed. He's not really delayed. Teachers have masks on. So let's be honest. We're doing what we're doing for the sake of others. Certainly the younger population is doing this for others. We can't get the hockey rinks figured out because we can't be nice to each other, and we can't manage to figure that out either. People are so irate, and I get it. I'm irate. You can tell I'm irate. You can tell I'm nervous this morning, because how come the board, forget the CERB that we're getting, that the $500 that everyone's going to get. I would be absolutely appalled if anybody actually applied for the vacation response thing. I mean, if you get that, I mean, you're going to choke on it. I just wouldn't want that money in my house, because that's not a karma I'm willing to have. But if you order in that CERB and you get it and you get away with it, I wouldn't want to meet your maker. That's all I'm going to say. But that being said, what are we doing? What are we doing when half the population is doing what's required and half the population is doing what's legally required? The borders should have been shut down in March. Why is there a question of travel? Why are we talking about travel? What's travel got to do with anything right now? How did everybody feel so good about going away? How did they book their tickets? How did they get away and go, which legally they were, and that's fine. I'm not mad at those people. You did it. Good for you. Good on you, because it's not going to make a damn bit of difference in the grand scheme of things, except on the nurses and the frontliners and the doctors who can't get a day off. I didn't hear, but on the 31st, their entire vacation system was removed. They were not allowed to take a day off. They can't take a day off out of respect. Whether you believe in this virus, don't believe in this virus, I don't give a crap. Out of respect for those people that can't get a goddamn day off, it's time to stay in your house, do what you're told, do it so that we can get out of here. I can't stand being in this house. I can't stand it anymore. I'm losing it. I want to be out with you. I do have days where I sit and cry all day because I'm bored. I feel like a baby, and I feel like a spoiled princess. But my frontline workers, who I know, and I try to get to be into, you know why I haven't had an interview with a nurse? Because they're terrified of losing their jobs, on top of the fact that they can't get an hour off. I can't get anybody to interview with me. Where are we in time, in the grand scheme of historical timeline? Where are we that nurses and frontliners can't speak out for fear of their jobs? Stop and think about that for a minute. We live in Canada. We're hiding when we don't Purell at the door because we're terrified that we're going to catch a liver disease based on the fact that there's so much Purell at the door. We're hiding our cars in our garages so that you don't know that my mother's here. She's 80. She's coming over. Come on over here and give me a ticket. I really challenge that one. Please do. She's legally allowed, but she wasn't always legally allowed. I see my mother. I'm owning it. I want the cops here. Come on over. I'm into it. Bring it on. I want to understand why I can't see my parents, my grandchildren, based on the fact that the rules are in place, yet people can head off to Barbados, our leaders no less, who are making a complete farce out of us anyway. They pre-recorded their vacation. So the vacation, please stay home and be safe. I mean, are you kidding me? You pre-recorded that and you didn't think you were going to get caught? What are these nimrods doing over there? They're in Barbados and here and there and everywhere, and we're staying home, and I can get a fine for having my mother over? I'm cooked, guys. I'm cooked, guys. I don't know what we're going to do about it. I don't know how we're going to handle it, but I can tell you moving forward, this has got to change. This has to change. The way we're handling it has to change. As people, it's time to stop, think, and figure out what we're going to do. Our leaders are failing us tremendously. Can we agree? I think we've got a little bit of mishmash of this and a mishmash of that. Nobody has the balls to actually close the country down and do a 2-week close down. We need a 2-week close down. It's really not that complicated. Shut the shit down for 2 weeks. Know this, know that. Nothing. How about nothing for 2 weeks? You have to plan to have enough medication in your house unless you're going to the hospital. That's it. Hospitals are open. Everything else, shut it. I got 2 weeks for you. Do it. Let's get this done. I mean, these kids are off school, on school, off school, on school. We're going into a whole other debate of whether we're going to bring them back to school now. So we're doing it all over again. Seriously. We've got till April. We could have done this I don't know, if I was Valerie Plante, no offense, Val, but shut the bloody city of Montreal down. It's an island. Shut it down. You get in or you get out. You've got 2 weeks to figure it out. On February 1st, the island of Montreal is shut down, closed. I don't know. Is it that hard? Is it really that hard? Just do it. Just stop pussyfooting around this and stop making us angry because you got an entire population that's angry. But maybe that's the point. Is that really the point? Are the conspiracy theorists actually right and we've been laughing at them the whole way and slamming them on are they right and we're wrong? Are the ones that are staying home wrong? Because I sit here and watch the numbers go. I haven't been out since March. What have I done? I've gone here, I've gone there. I've got my head blown off for going to Costco. Don't worry about it. There's a lot of trolls out there. But you're telling me that I've been in since March and we haven't figured this out and now we're still reacting? We're reacting. How can you be reacting at this point? The first one we isolated, no question, no problem. Everybody had to do it. We were terrified. Everybody was terrified. I was crying in my soup. I couldn't figure out what to do. I thought I was going to die. I thought I was going to go broke. I thought everything. I thought it all. So, okay, that's 3 months. Moving forward, you now know that this is a potential, I don't know, I heard second wave in March. So I knew there was going to be a second wave. It's not that complicated. Second wave is on the way. Wouldn't you think taking the welfare money that's in the billions of dollars, considering we're all doing this for the healthcare workers and for the hospitals themselves so that they can properly treat those that get sick, because we're not they've also said, we're not stopping COVID with the cotton masks we're running around with. We're not. It's too small and it gets through. So unless you're wearing a super duper hazmat expensive mask from the hospital, your cotton mask is stopping other things from happening, but it's not stopping COVID from happening. So that said, we're okay. So wouldn't you take the welfare money that you're giving to everybody, including complete immigrants that come here? I have no problem with it. My grandparents are immigrants. I'm good. Give the money, but you're bringing it. There's 250 people a day coming into Canada. Immigration. Now. How are we going to pay them? How are we going to take care of new people? I don't understand. I don't understand what everybody's thinking. How much voting is important here? What is this, a political thing? Either way, getting back to what I was trying to say, funnel the welfare money into the healthcare system. It's not that complicated. March was March. We were screwed. We didn't know what the hell was going on. Everybody gets a mulligan there, everybody. But after that, start putting the money into the hospitals. I don't know. The Royal Victoria Hospital, one shit ton of friggin' rooms in there. Wrap it up. Make it nice. You know what I would do if it was me and we're short of nurses? Up the prices of the nurse. Pay these poor souls. Pay them well. And you know what? A bunch of people from all over, we're letting people in anyway. Let some quality nurses come in from another country. Why? Because they overpay their nurses in Canada. Guess what? We'd have a shit ton of friggin' nurses. It wouldn't be complicated. It's not complicated. Bring them in. We're spending money like drunk people anyway at the government level. It's a drunk fest. So spend it on the people that we actually need. Fix the hospitals. Put up a few more hospitals. It's not like our healthcare system was so fantastic before COVID. So this is an opportunity to let people work, inject money into the system, into the right system. We're no longer reacting. We should be proactive. Our healthcare system sucks lemons. We all know it. So fix that. Stop giving me money to not work. I want to work. I like working. I'm good. I want to go to work. Everybody wants to go to work. I'm happy to work. I'm seeing my friends. I'm happy. So put the money into the healthcare system. It's been almost 10 months. Put the money into the healthcare system. Stop shoving it into people so that they stay home and be angry. That's where you lose me. What's the problem? What is really the problem? What are we not seeing as people? Because every directive has a confusion to it. How come it's so complicated? I've worked in government. I've been elected before. I know how hard it is to get things done and make decisions. I'm familiar with that process. This is not that. That crisis was March. We're not in a crisis that way anymore. We know what we have to do. Look at the difference between isolating last time and isolating this time. We were terrified and crying and crying and crying. I'm not terrified right now. I'm not crying right now. Irritable? You got it. Fed up? You got it. Tired of watching the debt that's increasing for my children to have to pay that will probably never pay in a country that's giving out money hand over fist for nonsense? That money should only be going into the healthcare system. We live in a society where hockey players make more than doctors. There's something wrong with the way we think. I'm not saying hockey players shouldn't have their money. Good for you. But our doctors, come on, guys. Come on. It's been since I was a child. Doctors are underpaid. They leave the country. So, if we have all this money, give it to them. They deserve every bloody cent. They save our lives. Give them the money. Make the most prestigious job in this country, doctors, nurses, and people that take care of us when we're sick. That's what we should be revering. And if we fix that, we wouldn't be in isolation. Because you'd go to work, you'd get COVID, and you'd go back to work. You'd go to the hospital if you needed to, or you wouldn't. The worry has always been, are we going to overrun the hospitals? Well, we're overrunning the hospitals, but nobody had the wisdom to shut the border. So really, I missed all this holiday with my family, and you didn't think of closing the border? Are you that stupid? I know that's not a thing to say, but are you that stupid? Don't give me the frickin' $500 problem that when they come back, they get $1,000. I don't care. They shouldn't have gone in the first place. If I'm home, they shouldn't be allowed to travel. It's simple. It's not rocket science. You don't even need a degree to figure this one out. You traveled. You had every legal right to travel. The fools were the ones that didn't go. Because guess what? They're back and nothing's changed. And the entire duration of this whole thing, the higher numbers were gone. They're not even here yet. And the numbers are through the roof anyway. So what difference does it make? I've got a son whose phone is loaded with parties. Loaded. Mom, you see the parties? You see the parties on my story? You see the parties, Mom? My daughter's 30. Her phone is loaded with parties. Bottle sharing. I don't know, guys. I don't know. But sitting here like fools is starting to feel just like that. Sitting here is like being a fool. And I don't know what to do about it. And I just feel that we need to have a little bit more awareness and a little bit less of something. Send a letter to your member of parliament, your MP, somebody. Send letters out to who? I don't know. I got to tell you, there's millions and millions of dollars that went out to the ads agencies. COSET is an ad agency in Montreal that handles the government distribution of ad money. Do you want to know how many people do I reach on the West Island blog every single month? 500,000 people read my blog every single month. Okay? They repeat, so it's not all unique visitors. I get that. You don't need to say it. But I reach 500,000 people a month. Do you know how much I got from the COSET ad? $8. $8 a month. Millions, hundreds of millions of dollars was distributed to raise awareness for COVID and to teach people how to wash their hands. I got $8. So I want you to know that that money ain't coming down to the people like me. So all that millions and millions of dollars, not seeing it in this house. We work our asses off, but the money doesn't come to us. I don't know where that money went, but it sure as hell isn't reaching the 500,000 people. I'm doing that. I'm making sure you have the news, not the government. So don't be fooled by the ads that are in my blog. It's $8. So that being said, I don't even know what the roundup of this is going to be because I'm so appalled. I'm so disappointed. Not in the people that traveled. I'm disappointed in the fact that the rules didn't extend to travel. It should have extended to travel freaking in March. So don't be mad at the travelers who actually gave up and went. If you don't have parents, I'm staying home because I need to protect my parents, which by the way, both of them have had COVID and they're fine. So not to discount what the hospital people are living, but if the hospital is the only focus, that's our only focus, people. That's the only reason we're doing this. So if the governments are listening, which I highly doubt, but if they are and they can actually do something, it's time to actually be reactive and not proactive instead of reactive, because our hospital system, if this is going to go on, and let's just say for argument's sake, the conspiracy theorists are accurate, and this is chemical warfare, and this is the new normal for us. Get the hospitals in check. Stop spending money on nonsense. Stop sending us all money. We know how to eat. We got it. We'd like to go to work now. We did that. That was the emergency measure. This is not an emergency measure. It seems to be something that we're going to have to contend with. So if that's the case, funnel the money into the healthcare system and let us get back to work. That's what I'm asking. See you on the other side, guys.